Good afternoon, everyone. Thanks for joining us. I'm Teresa Freed, Assistant Director of Public Affairs and Communications for Johnson County Government. We apologize for the short delay before we had this up and running. We had a little technical difficulties, but we are here. And we have with us Dr. Sami Ariola, Director of the Johnson County Department of Health and Environment, and Becca is providing ASL. Thank you guys for being here.
Thank you.
All right. You want to go ahead and start us off with just talking about the vaccine clinics, both from this weekend and the week ahead. And then obviously a big change this week, the 12 to 15-year-olds now being served with their parents.
Yes. Good afternoon, everyone. Our clinics are still running, and last Saturday, we vaccinated over 1,200 persons with about 300 walk-ins. And the reason we have that many is because of the approval, the new approval for the vaccine for residents that are 12 to 15-year-olds. Really good development because it does provide the opportunity to vaccinate what has been quite also a group that has had their fair share of infections nationally. For United States residents that are aged 12 to 17, we've had 1.5 million infections in those groups, and 13,000 of those infections have resulted in hospitalization. So while our older residents are more vulnerable to the more serious consequences of the infection of the virus that causes COVID-19, it does infect younger people. And right now, we are seeing that younger people are getting infected in the county and in the region. And our health systems are reporting that 100% of their hospitalized COVID patients right now are those that are not vaccinated. So we've made a lot of stride in vaccinating our older folks, more vulnerable population. We have vaccinated intellectually and developmentally disabled persons. We have reached out to our homeless population. We are vaccinating our homebound patients. So we have strategically reached out to vaccinating our more vulnerable population. And so right now, that approval opens the door for us to get the vaccine into the arms of even more persons. So staff were able to speak to parents and some of those students that were vaccinated, and it's really good to see the excitement. And we see this also coming out on Thursday, really affirming what we know, affirming what studies and more data is pointing to, that those that are vaccinated, fully vaccinated, that's 2 weeks removed from your second dose of Pfizer or Moderna and 2 weeks from your Johnson & Johnson vaccine. Those that are fully vaccinated can now interact in the indoor environment without wearing masks, without physical distancing. That's huge, and that's the data is pointing out to the fact that the vaccines are very, very efficient. They are protecting us against death. They are protecting us against hospitalization. They're protecting us against serious illnesses. And so there are some what we call breakthrough infections, but even those are just a handful, maybe a few thousands out of the millions that we have given. So those, even when people have it, they are typically very, very mild, typically not requiring hospitalizations. And once you are vaccinated, fully vaccinated, your chances of infecting other people is very, very, very low. And so having 12, 13, 14, 15-year-olds now qualify, being able to get vaccinated, so they're free to do the things that they love to do, free to participate in sports, not worrying about getting infected and hospitalization, not worrying about being in quarantine. That's the added advantage. If you are vaccinated, unless you are really showing symptoms, you are exempt from being in quarantine. So tons of advantages. I am happy to see the CDC come up with that. I'm happy to see adolescents getting vaccinated. Parents are happy, the children are happy, and that's again also moving us closer to population immunity that we need. And when we get there, so for those that we cannot vaccinate, either for medical reasons or other reasons, we can also protect them. But again, to be clear, that CDC guidance is for those that are vaccinated. If you are not vaccinated, the risk of infection remains high. If you are not vaccinated, the risk of serious consequences remain high. Again, indication from our health systems around here is that 100% of those that are currently hospitalized for COVID are those that are not vaccinated. For us, the cases that we are seeing are occurring in younger unvaccinated persons. So again, just pointing to how efficacious and safe the vaccines are.
And can you remind us again how it is that those in the 12 to 15-year-old age group are able to get vaccinated? I know the schools have been helping out with the older students, but we're at the end of the school year, so there's a little bit of a different process for that, right?
Oh, you're absolutely. We started vaccinating on the first day of eligibility. We opened up our clinics, and quite a lot of people booked appointments, and a lot also were able to walk on. And we're going to do that the same thing this week. We've got clinics open tomorrow, 9 to 3, Wednesday 9 to 3, Thursday 3 to 7, Saturday 8:30 to noon. And all of those, we have seen an increase in the number of appointments, but also there are opportunities to just walk in and get vaccinated. So, and I expect those to continue to happen. But as we've stated from the start, it's not just us. We know that Children Mercy, who has really taken the lead in vaccinating our children, are vaccinating. They have events planned. People can get vaccinated at all of our health systems. People can get vaccinated at pharmacies. I also saw that same Thursday, several local pharmacies saying, hey, if you are 12 to 15-year-old, you can book an appointment, we'll vaccinate you. That's working. There's just so many opportunities to get vaccinated right now. And I love the enthusiasm. I know that Children Mercy is planning other programs that are geared towards this age group. And if you really see the excitement on the faces of the younger ones, again, seeing the light at the end of the tunnel, now they can interact with their parents, their grandparents, without feeling like they are putting them at risk. Really, the excitement is very good to see, very nice to see.
And so just one additional effort that's underway to make sure people have access to the vaccine is the community clinics concept. And so can you talk a little bit about where we're at with getting those rolling?
Yes, thank you, Theresa. That's as we uh, continuing our vaccination effort, we really broke our effort down into multiple phases. We thought that once we get into the 60% vaccination range, that the numbers for our mass vaccination clinic, while still high, is going to drop. And then we're going to now shift a lot of resources to community clinics. And that's what's happening. Last time we saw last week that our numbers are right in the mid 50s of our residents that have gotten their first dose. That's encouraging. Lots of work to do yet, but that's good. Now we are working with our partners in the community. We are working with UCS. We are working with our religious organizations. We have programs that are coming up, and we're setting up clinics that are targeted towards different groups. And so we may not be doing 3,000 vaccinations in one spot like we were doing before. We're going to be doing a couple of hundred here, 50 there, 70 there. All of them will add up to getting more vaccines into the arms of our residents. A couple of those events, for example, is we are going to be vaccinating with Pastor Love, Second Baptist Church this Saturday. We'll be doing that. We are planning an event with UCS and several churches later in June to do a Love Thy Neighbor event where we have clinics set up in about 10 different churches across the county. We had what I thought was an excellent conversation with the city of Overland Park on Friday, with multiple events being planned. We're working with our farmers market food pantries, and several other organizations across our cities to vaccinate. So many things going on. The staff are reaching out. They're calling our restaurants. We are looking for opportunities to vaccinate. We're looking into opportunities to use mobile clinics. We're waiting for hours, but there's one available in the community to reach out and vaccinate. Just ensuring that if you want the vaccine, you can get it. Now, we do know that initial 50, 55% persons that got out of their homes to go to vaccination clinics, that's a group. The next group are people that are really interested in getting the vaccine, but for different reasons. Either they don't want to go out of their way to get it, or they're busy or something, that if they find an opportunity to take it, they will get vaccinated. That's why the community clinic is very important to our efforts. We did create last week, open up an opportunity on our website for companies to sign up and request for us to come. And I believe that we've had a few. We have our first response with it. I believe the first day that was posted, and we are finalizing plans to take vaccines to the company and vaccinate their employees. And so again, those that are listening, if you want to partner with us, you have a company or an organization that you want us to bring vaccines to, we'll work with you, complete the form online. Our staff will take it from there, reach out to you, work the logistics out, and bring the vaccines to you.
All right, and just one more way that we're trying to make the vaccine available. I know that we're communicating with family physicians, for example, to try to make sure that they have the vaccine available and they have the whatever they need in order to administer those as well, because where some people might not necessarily want to go to a large clinic or even a community event, they may feel more comfortable going to their physician's office. So can you talk about efforts to make that available?
Oh no, absolutely. There is no one that I personally trust more for my health than my primary care physician. That's who I see for my yearly physical. That's where I get my flu shot, and that's true for most of our residents. And we've got surveys both in our region and across the country pointing towards that. People take medical advice from their primary care physician. So when they go for their yearly physical, we want the vaccine to be available there. And so several of our health systems are already doing that. And so they are making sure that the vaccine is available, not just at their mass vaccination events, but with their physicians across the system. And we're reaching out to some of those larger group hospitals that are not part of the big health systems that we've been working with, and ensuring that vaccines are available for people when they go to visit their doctors. By the way, long term, that's how this is going to happen, very similar to the way that we get our flu shots. We very seldomly, it's been a few years since we've had mass vaccination events for flu. People just go to the pharmacy or go to their doctors and get the flu. The long term, that's what's sustainable. But the key point though is the biggest trust that people have is with their primary care physician, and we're working with different groups. You mentioned the family physician academy group in the state that Dr. Lemaster and Dr. Jacobson are reaching out to, and going to be talking to them, actually talking to them right now as I'm speaking, to finalize some of those logistic details. But yes, our doctors are very, very critical to providing opportunities for our residents to easily get the vaccine when they want it and if they want it. And we want to make sure that we make that as feasible and as easily available as possible.
And I know you've mentioned this before, but it certainly bears repeating. Even if you've had COVID, you still probably want to get the shot, right? Because it gives you even greater immunity. So can you explain that a little bit?
Yes, yes. So if you are infected with the virus that causes COVID, your body does, as it does, respond to other insults, other foreign materials, will produce, in this case, antibodies that are designed to fight the infection. Right now, based on what we know, we would say that lasts for about 6 months, that protection. For a long time, we were using 3 months. But here's what we know about the vaccine. The vaccine produces antibodies at a level that's about 10 times what you get from infection. Now, if you are previously infected and you get vaccinated, we are also seeing data that shows that you are even more protected against certain types of variants. So your question is, should I get vaccinated? Absolutely. Do you have some protection from infection? Yes, within a limited period of time. Is your protection better with the vaccination? Absolutely. So you should get vaccinated whether you've had the infection or not.
Okay, and just last question. I know the CDC came out with their guidance, updated guidance on mask use, and KDHE adopted that. We adopted that. I don't know if you were out and about at all this weekend, but it was kind of a different situation. You know, you saw some stores that had people walking through without masks, and some people didn't feel comfortable, maybe, and some people were comfortable doing that. So we are starting to see a little bit of a shift, and we do want to reiterate, though, that there are still people who are vulnerable to the virus. So can you talk about, how do you carry out your day to day now?
Yeah, thank you. I think that's a very, very important question that you asked, and I'd love to take some time to explain. First of all, the revised guidance from CDC is addressing those that are fully vaccinated. If you're fully vaccinated, your risk of being infected is very low, very low. Your risk of getting other people infected, very, very low. Now, if you are not, that doesn't hold true, okay? If you're not, you can be infected. If you're not, your risk of spreading that to those that may be more vulnerable than you are is very, very high. That's the first point. The second point is, again, if I am in a place and I see the struggle that businesses have, if I'm in a place and I am vaccinated, depending on the scenario, if it's crowded, I would put on my mask. If I feel like it's not a properly ventilated place, I'll put on my mask. But I do not want to undersell what we are seeing about the efficacy of the vaccine. They have proven not just to be effective against the wild type, but against the variants that we are seeing. So the advantage is to those that are vaccinated. Now, if you are with other unvaccinated person, your risk is even lower. Now, if you are unvaccinated, again, that guidance is not for you. If for whatever reason, medical, religious, you are not vaccinated, please, please, please put on your mask. Physically distance, avoid crowds, and ensure that you spend more time outdoor in well-ventilated areas. All of those steps that we've been saying. This revised guidance is not for you if you're yet to be vaccinated. And so still got to take those into consideration that even our 12 to 15-year-olds, we've only had a few days of opportunity for them to be vaccinated. So we still have a long way to go. Those that are younger than 12 do not currently have vaccines that are approved for them. So I absolutely love that CDC is giving the credit due to the vaccines by saying if you are fully vaccinated, you can do this. Absolutely great. But we do need our residents to understand that's for those that are fully vaccinated, 2 weeks removed from the second dose of Moderna and Pfizer, and 2 weeks removed from their first dose, from their one shot of Johnson and Johnson. That's that. The guidance is for those that are fully vaccinated. It's not for everyone. It's not for those that are not vaccinated. And if I live in a home with somebody who is at risk, who is quote unquote a vulnerable person, I will be even more careful. I will avoid crowds and I'll continue to wear my mask. That's the message that we need to keep in mind. I do applaud that decision, though, giving the credit to the efficacy of the vaccines.
All right, some great information. Anything else you want to say before we close up?
We continue to have multiple opportunities for people to get vaccinated. There are vaccines at your pharmacy, there are vaccines at your hospitals, and quite a lot of doctors are carrying the vaccines now. And of course, we've got a vaccine clinic at our Lenexa location, Tuesdays 9 to 3 this week, Wednesday 9 to 3 this week, Thursday 3 to 7 this week, Saturday 8:30 to 12 this week. You can book an appointment, you can also walk in, just ensuring that our residents have all the opportunities that they have. And so the more people we get vaccinated, the closer we get to our population immunity. The more people we get vaccinated, the more successful we are in breaking the transmission cycle of this virus. And I use the example all the time. So let's assume what we call a reproduction number of two. That means every infected person will infect two other persons. So the initial two people potentially could infect 4 people each. Now, if half of those are vaccinated, moving forward, by the time you get to the second generation, third generation, you're already reducing the number of potential infections by half or more. And so the more people that we get, and if that number goes to like 5 out of 8 persons that are already vaccinated, then only 3 people rather than 8 potentially could spread that. So we are reducing that number from spreading to 16 people to maybe potentially 6 people. That's how you break the chain of transmission. And that's what we do every time we get the vaccine into every arm. So go and get vaccinated. Multiple opportunities are available right now. Thank you.
All right, very good. Well, we will be back here at 9 a.m. on Wednesday, so we will see everyone then. Thank you all for joining us. Have a great night.